Hi everybody, I'm Dan. I've got Dr. Bilski here from Bilski Dental Group. So today I came across this article and I immediately thought of you, which is actually why we're in here right now. But before we even get into that, this is not scripted whatsoever, but Dr. Bilski has always been this big fan of, if you take care of your gums, you can avoid all sorts of diseases, cancer, all sorts of crazy things that I never thought of. Alzheimer's.
Pneumonia.
Okay. So this article I came across, and I'm sure you already knew all about it, but I was like, I got to get you in here. Is, I guess, at least the article claims that you can have, if you have gum disease, you have a 9 times probability of getting in really big trouble with COVID. So talk to us about it. That's like the big thing right now. So what is that? How is it even a possibility? What's the mechanics behind that?
Okay, so I could honestly give probably an 8-hour lecture and then come back the next day and
do it again. Yeah.
So what we're talking about here is inflammation. Any disease process. Mm-hmm. And by the way, our bodies are in constant inflammatory responses to whatever it is. So because it is a pandemic and COVID is, that's what we're talking about.
Right.
I mentioned in another interview that I do public speaking, webinars, and I write articles. And I had to write an article on inflammation. So the very things that we started with, cardiovascular, stroke, mm-hmm. pneumonia, Alzheimer's, for the men out there, erectile dysfunction. So it does hit our entire bodies. What they have found with the patients that are coming in with the pneumonia symptoms or the COVID is that I think it was like 80 or 90% of them had some form of gum disease.
Wow. That just seems so wild to me that something as simple as flossing, a preventative measure, so to speak, could have solved. But just the fact that it's coming from your mouth.
Well, so you asked about the mechanics behind this.
I'm very much like, I want to understand how it works.
Yeah.
And I think our audience wants to know how that works too.
We're going to be uploading, which Dan does, our uploading for our website. There's a very nice thing on YouTube, and I can't recall off the top of my head the name of but it explains gum disease and inflammation. Mm-hmm. Mm-hmm. So this is what happens. The bacteria that we have in our mouth, there's about 400 of them that are just nasty little critters. Mm-hmm. And they're so small and tiny. What we do is we get this inflammation and these ulcerations in our gums. Mm-hmm. So it's called a pocket between the tooth and the gum inside, where the hygienist, when you come in to get your teeth cleaned, she puts that little probe.
Right.
And we measure, and we want to be 3, 2, or 1, or 0.
Okay.
But when you start creeping into that, 4 is kind of like, you need to come in 1 extra time a year. 5, 6, 7, that's gum disease. What happens is the bacteria are able to get into those ulcerations and get into our bloodstream.
Gotcha.
Here's the critical factor that most physicians and dentists don't know. They're so tiny that they can sneak past our immune system.
Wow.
So by the time our immune system recognizes it, it's too late. The damage has been done. So the fibers that hold our gums to the roots of our teeth and our bone start to cleave. Reduction in circulation because of the inflammatory response. So that bone shrinks back. If the bone shrinks back, the gum shrinks back. Mm-hmm. Then the bleeding of the gums, the loosening of the teeth, sometimes pain. And the term is fetid odor. And everybody has bad breath once in a while. It's usually from what you have eaten or ketones because you're sick. Mm-hmm. But the fetid odor of periodontal disease is very distinct. Mm-hmm. If you smelled it once, you'll never forget that smell. Mm. That's the process. how do we mitigate that?
Yeah, I was going to ask that question.
Yeah, there are a lot of things now that are a lot better. Floss is a great way to do it. What it does is it gets air, oxygen underneath the gum, because those bacteria that cause the gums disease.
I mean, that alone, just telling people why to floss helps.
Exactly.
You know?
And here's the thing, it's hard to do. Some people don't have the dexterity. They don't care to have it's just what happens.
Fingers are too big or whatever. Yeah.
Well, yeah, exactly. Banana fingers is what we call them. So there are other options, alternatives. The water pick. Now they've really geared that in where it's cordless. You can take it in the shower, which we recommend because it's kind of messy.
Yeah.
But you would be amazed at how much you can get out from between your teeth after brushing and use that. You'll see particles come out.
Really?
Which is kind of a wake-up.
I've never used it, so that's interesting.
Well, it's a wake-up call sometimes. When you see that come out and you've been told your gums are bleeding or you notice it, I think you should start doing that. It's adjustable, so you're not power washing.
Right, gotcha.
And then the adjunct of the toothbrush and the toothpaste and your mouth rinses and all the things you go on into it, it's just creating a routine. So what we have found, the thing you said is why I need to do what I need to do. So we call it extreme ownership in our practice. And what that means is if you're coming in and you're an existing patient and you continuously have bleeding gums, we keep telling you, I need to stop and explain why it's my fault. I could have helped mitigate your problem or the problem.
Right.
And the question is, what other additional information or help from us do you request or require so that we can get you to a point where we optimize your gum?
I feel like this video would do it, actually, because it explains the mechanics, you know.
But
it's not. It goes beyond clean, right? Because this goes way beyond.
We're talking normal physiology. Like this is cellular.
Right.
This is microscopic. And no disrespect, but I am a nerd, and I like this stuff, and I like to know why things are the way they are. And when you go through dental school, you're just inundated with a lot of minutia, and you try to just get rid of the stuff, and then you want to do the stuff you want to do.
Right.
And then you see a patient coming in, and you know you should talk to them about flossing, and you've talked to them so many times about it, it's just not sticking.
Right.
Then just because of the change of my perspective now, and probably over the last 5 or 6 years, is what we're trying to do. We're trying to accomplish this. Like, look, what is it that you need to know? Because it's got to be my fault that your teeth and your gums are doing what they are doing. Now, if you're saying, Doc, I get it. Thank you for your help. I'm taking full responsibility. Okay, I guess that's what it is. We have people that are very ill that don't take their medication and they have cancer. They don't go through treatment.
Right.
So I can only respect what the patient is requesting.
Right.
But when we're talking about the gums and the teeth, it's a very simple, I don't know what even what floss costs anymore.
It makes me want to go and floss my teeth.
Something to think about for sure.
It is, absolutely. So think about that, guys. Something so simple as just flossing your teeth. And I don't know, what's your opinion on mouthwash? Where does that stand in this?
I think anything that you use that makes you feel better about your oral health. So we're just trying to optimize it for the rest of your life.
Right.
Whatever that is.
Right.
There's Stella Life, which is a vegan, all natural, 16 different natural products that people love. They're changing the flavor. It's a gel, it's a spray, it's a rinse, whatever you want. You can look on our website. We're not a retail shop for it, but we do have it if you want to pick it up for us, and then you can order it online.
Yeah.
That's one. The Listerine, it's a rinse, salt water, teaspoon of salt in a glass of 6 to 8 ounces of tap water is enough to rinse with. That'll help change the pH in your mouth. Anything that you can do. Now, the other thing that with periodontal disease, sometimes you get a dry mouth situation from medications.
Okay.
So we may have you do some other things, but just off the top, brushing, flossing, water picking, and whatever mouth rinse you like, and check the ingredients if there isn't any saccharin or sugar products.
Okay.
To help, like a lot of the kids stuff, it makes it sweet.
Counterintuitive, actually.
Right, exactly. And that's the big thing right now. And then, or any other natural product that you feel that looks good, but anything that has the American Dental Association logo on it, is a pretty good place to start.
That's good. That's a good tip right there alone. Just look for that.
Yeah.
ADA. All right, guys. Well, I guess we started out with this being COVID related. I think during this period of time, you should definitely consider some of these things, but also beyond COVID, just in general, staying healthy and how your gums really.
So yeah, good. I'm glad you brought me back to the topic. This is how you go sometimes when we get a nice topic. You're more susceptible to COVID because of the inflammation and the ulceration intraorally. So when you have an aerosol, I cough on you, you have gum disease, that is an easier, quicker way to get into your body through the ulcerations based on the mechanics of those small bacteria that sneak underneath the radar of the immune response that we have.
Yeah.
So it's like a 5-way or a 5-lane highway.
Yeah. Straight into your body.
It's right into your blood system.
Wow.
That hits your lungs. The lungs and the heart are right here.
Right. So it's not too far off.
It's not a short, it's a very short distance and undetected.
Yeah.
That's why you go back just to the pneumonia part of it. Most of the patients that are typically elderly that have dementia, they'll have pneumonia because of the inflammation of the gums. So COVID, for sure, your chances of going up quicker.
Well, that's been a fantastic segment for us to talk about, especially in this climate. We want to help you guys out the best we can. If you guys have any other questions around this, or you want to have your gums inspected, I guess they can come to you, right? If they feel maybe have been to the dentist in a year or two or whatever it might be, Dr. Bilski and his team can help you out.
Look forward to seeing you.
Take care.